is king.
Sing is king. I want to be king. Okay. Hi everybody, Ziv Simon here. I'm the creator of Surgical Master, and welcome to this interview with Dr. Sandeep Singh from India.
Namaste.
Namaste. Thank you for joining us. I appreciate, and I also appreciate the nice gift that you gave me this morning.
Thank you so much.
Could you tell me a little bit about what I'm wearing?
Yeah, it's a silk, Indian silk.
Okay.
Especially Varanasi.
It's beautiful.
Varanasi is a place in India. It's the holiest city in the world for Hindus, and it's the oldest living city.
And thank you so much, and I appreciate that. And we've known each other for some time.
Yeah, almost
for a year, maybe over a year.
More than a year.
And I followed your work in the implant world,
Yeah.
and your teachings and your academy.
Yeah.
But actually, we never met physically.
Yeah.
So when
This
you
is for the first
when you called me yesterday, I'm like,
Yeah.
wow, you're here.
Yeah.
Come on to USC, join the course, and I'm so
Yes,
happy that you
definitely.
made it.
I'm honored, and I'm like when I called you up, and the kind of response and the warm welcome it was that joined me as a guest. I was thrilled.
Absolutely, absolutely. You are my friend and you're my brother, and we are so happen to be two dentists
Yeah.
that love dentistry
Yes.
and love surgery and love treating patients. And I wanted to know a little bit about how are things in India in terms of dental implants, more aesthetic procedures, from what you're seeing the difference between the United States and where you practice.
Definitely, we lack into. Like the kind of conditions we are working. Since the armamentarium, like in dental implants, most of them are manufactured outside India.
Okay.
So a lot many people are doing one of the world best implants like Nobel, and but after Nobel, what I found that the Korean implants are pretty popular.
Okay. The Korean.
Korean. Korean is Ostem,
Mm-hmm.
Neobiotic. These two implants.
That's
are,
interesting. So every region in the world
Mhm.
has its own preferences for different reasons,
Yeah.
which is to me is fascinating. And in terms of the techniques, in terms of, because I've seen what you're doing with piezo surgery,
Yes.
with
yes,
sinus lifting, ridge augmentation, that's advanced.
definitely.
Do you get your knowledge more from within India or from the outside and bringing it in? Where do you get your knowledge from? Because that's what I'm always curious about.
Yeah.
How does a dentist that is a general dentist learn and become such an expert?
Let me tell you that seeker. I call myself as a seeker.
A seeker.
Yeah.
You seek.
Yeah.
You're not a Sikh. You're not a Sikh, but you seek.
Yeah, I see. There's a learning curve. There's no end to it, and knowledge is something when you share, you gain more.
Mhm.
You share it and you learn more.
Right.
And this is the Facebook being a great medium.
Right.
Made this world very small.
How many dentists are in India, by the way?
Huge.
Many dentists. How many,
Huge.
Roughly?
I cannot. I have no idea about the demographics.
In the
Yeah.
tens of thousands, hundreds of thousands?
Hundreds of thousands.
Hundreds of thousands of dentists in India.
Yeah, because the Indian population is just maybe it has crossed China.
So it's over
So it's-
1.4 billion?
Yeah, it's more than that most probably. So one thing I really I feel bad about it, like CBCTs, and which is now an essential tool.
Okay, for implants.
Implants, and even in endodontics,
Hmm.
like CBCT is being used a lot.
Correct.
We still lack onto that.
So, in a way, I'm looking at the challenge that you just mentioned, but I'm looking at more as the positive side.
Yeah.
That means that you had to develop
Yeah.
certain skills
Yes.
that are
Yeah.
more than the average,
Yeah.
way more than the average, to overcome. Because for me, a CBCT is quick. We have, everywhere you throw a stone,
Yeah.
there's a machine.
Yeah.
And it's not expensive for the patient because there's so many of them.
Yeah.
So you had to develop some sort of skills and methods to do this in a safe way? Because I've seen your work.
Yeah.
So how did you do it?
See.
How did you educate yourself?
Human race, like we human being, are very adaptive.
Okay.
We adapt to the situations, and that is what has happened in India, and especially with me, because if I'm not able to get the CBCT, what to do? I have to place implants.
Correct.
I am not having those guided surgical stents. I do it freehand.
Okay.
It's just freehand, and I developed that skill, that being freehand, and still I'm keeping the parallelism.
And you're getting nice results, I have to say. Not worse than guided surgery. So that impressed me.
Because when I went to Busan and other places in Germany and other places, when they see the cases, they say, "How can you do this without having a guide and a surgical stint? I cannot go for this freehand."
Got it. And you did it. So I honor you for that. That's very, very impressive.
I have an academy by the name Sahaj, Sahaj.
Okay. And what is the website for this academy?
It's sahajdentalacademy.org and .com.
Okay.
Yes.
So, Dr. Singh, thank you for coming to the course. It's a pleasure meeting you in person.
Definitely.
We will keep in touch.
Yeah. And I would
thank you again.
love to to see you in India with your academic work, and I think you have a group or you have that.
We got a lot of things that we can definitely bring to India at some point. I look forward to doing that. Okay, so thank you again. Thanks for taking the time.
Thank you so much.
Okay, we'll see you next time, everybody.
Namaste.
Namaste.